Good afternoon, folks. We'll get started here in just a minute. Riley, Cameron, I'll have you cue me when you're ready.
Okay. Right. All right, just let me know when I should start talking.
Go for it. I think we're all set.
All right, so welcome everyone. My name is Cameron Robinson. I am the LGBTQ plus patient navigator for the LGBTQ plus healthcare consortium. Riley Craig, who was our healthcare specialist, will be helping in the chat. I want to go over a few things before we get started. Just as a reminder that the session will be recorded and later uploaded to our website. To protect all attendees' identities, we will not be posting anything to show attendees or their names. We ask that all questions be put into the chat, and I will read them at the end of the presentation to the presenter. If you feel compelled to give, we welcome donations to our Give Butter campaign. The donation will be given towards the trainings we offer, MedPath mentors, and future events. Please feel no obligation, but if you would like to donate, visit our website and there will be a donate button in the middle of the homepage. One of us will be dropping the link in the chat. If you are receiving CEU credits for this webinar, this information will also be put into the chat. Okay, now with no further ado, let's give a warm welcome to Dr. Jay Knight. Jay is a nursing faculty member at GVSU and is experienced in informatics. We are thrilled to give an opportunity to learn from Jay, who will be talking about PrEP and HIV. Without further ado, I'm going to turn it over to Jay.
Hello, good afternoon. Thanks for spending lunch with me virtually. It's great to see you all. And I hope somebody's got peanut butter and jelly because I am feeling peanut butter and jelly for lunch today. Well, again, good afternoon. I am excited to be sharing our toolkit with you all, the PrEP and HIV toolkit that was in fact designed with so many folks in mind. Again, my name is Dr. Jay Knight. I do use they, them pronouns. I am a part of the LGBTQ plus community, and this work I'm honored to be able to do. I actually took on beginning understanding HIV and risk reduction for HIV during my dissertation for my doctorate. So I've been chipping away at this for quite a while. And I'm excited. Just last night, some of my dissertation work was formally published in a journal. So that's super exciting, fresh off the presses. As Cameron mentioned, I do come to you all with healthcare experience. I've been in the healthcare realm for about 20 years now. And that does include time in the emergency room and time as a nurse navigator for the stroke team. And really for the toolkit, I leaned into my informatics project work and degree program, as well as the innovation time that I had working as an innovator for the Priority Health Plan innovations. So that's a little bit about me, but let's talk about what we're going to talk about and then delve in. So today we're going to take a little bit of a tour of the toolkit's background and gaps that we sought to address and close. Why did we build this toolkit? What does it mean to you? How can you use its tools? And where's the evidence is definitely something we'll delve into very much. As a nursing faculty, I drive my students to evidence all the time. And we have learned that evidence and stories and time such as this helps to break down those stigmas and biases and assumptions that often get in the way of the way we deliver care, the way we seek care, and so much more. Also, speaking of stigma and breaking those barriers down, this is part of why we have this two-door approach, which I'll get into a bit more later. But you'll see that our PrEP and HIV toolkit has two different sides to it. And this is designed to serve many different audiences, as well as put actionable information in front of those who need it most. and designed with the ability to do a push and pull of information across the healthcare ecosystem. So thinking about us as community members seeking care, but also as you're walking out of the doctor's office, potentially with all of these discharge papers, how do you make that information actionable and easy to digest, and where can you refer back to, right? So these were all things that we kept in mind in designing our two doors. We're going to spend a fair amount of time for our lunch hour taking a look at a tour of the toolkit. Also want to highlight some of the great things that are coming next as far as what to look for within the toolkit and more. Also, before I get any further, I do also want to acknowledge that Ella, the med student that helped me with this toolkit project, she is doing her anesthesia rotation right now and couldn't be on with us, but do want to acknowledge that she did a lot of heavy lifting in the building of this. So let's talk about the background, the history, and the needs. What is HIV? Where did it come from? All the things. And I thought HIV was all over. Well, no, the HIV epidemic still continues to this day. We see new infections occurring. Also, let me back up. HIV, let's level set. Human immunodeficiency virus, HIV. And it's been around for quite a while, coming on scene in the late 70s, early 80s. Also, human or HIV is most commonly acquired via sexual transmission, so exchanging of body fluids through anal or vaginal sex, and or through the sharing of needles and or drug injection paraphernalia. So those are the most common ways that HIV is transmitted. Also, some things to keep in mind. Of the 1.2 million people in the United States that are living with HIV, approximately 13% of those folks don't know that they are positive, and thus are unknowingly exposing others. And which leads us to our next bit of evidence here, is that 30% of the new infections are traced back to folks that didn't know that they were positive. So again, when we knowing your status and understanding your risks helps disrupt that chain of infection. Also want to highlight that HIV is disproportionately impacting historically marginalized and stigmatized populations, including people of color, including transgender community members, specifically the Black and Brown transgender women are showing exponentially higher contraction of HIV when stood up against other counterparts. Research has also shown that, courtesy of COVID and shutdown, we seen a loss of HIV preventative services, a loss of access to clean needles and testing, and that disengagement in HIV preventative care, which had contributed to new HIV infections. So hopefully we'll start to see a turn back towards increase in testing and an increase in access, and seeing more folks getting preventative care in the coming years. So what is PrEP? Is it safe? Is it effective? I keep hearing this word, HIV PrEP Toolkit. Well, PrEP, also known as pre-exposure prophylaxis, is a med that you can take to prevent HIV. I want to highlight that it is not effective at preventing other sexually transmitted infections, but it is incredibly effective at preventing HIV. So much so that it actually vastly exceeds the FDA's requirements for a medication to be effective. It also shows that there are no serious short or medium-term safety concerns as it relates to taking PrEP. Also, PrEP has been very well deeply studied, and when folks take it when they're pregnant and or chest or breastfeeding, it is safe for that community and as another benefit of breaking that chain of infection. Also want to highlight as it relates to PrEP's effectiveness related to exposure. So when we take a look at HIV related exposures associated with injection drug use, PrEP is greater than 74% effective, which is outstanding, and also greater than 99%, or approximately 99% effective at preventing sexual transmission related exposures. So very, very effective medication and very safe. So why are we not using it more? Well, what does the research tell us? There are 1.2 million people that are estimated to be at increased risk for HIV, courtesy of, and would benefit from PrEP, courtesy of studies from the CDC. But when we look at who's getting PrEP and how often is it being prescribed, current state, per Siegler's research, only 10% of those eligible for PrEP are getting PrEP. Also, when we look at who's getting PrEP, there are disparities. So folks who identify as cisgender, white, and male, and also have private insurance, have a higher rate of receiving PrEP. Now, if you might remember from a few slides ago, we talked about the population at highest risk are those people of color, and those folks are actually highly underrepresented in the number of prescriptions we see written. So that is definitely a gap that we need to address, as mentioned in this third bullet point here. And despite there being a rise of new infections among the Black and Brown community, prescribing rates aren't moving up with them. So the gap is widening as opposed to closing. So what is the PrEP Toolkit going to do on health outcomes? How are we going to move the needle as it relates to addressing care needs? Well, here's a few areas that we focused on. The PrEP Toolkit, which you'll see in just a couple minutes here, focused on increasing awareness. And again, using that two-door approach. So awareness for the healthcare team is different potentially than awareness needs for the community and the patients, those at risk. Maybe they don't understand what their risk behaviors are. And that is why we've included the content we have. Also, as I mentioned a bit ago, the lack of PrEP prescriptions written within our community leaves folks at risk for HIV acquisition. And we've seen where bias creeps in and folks don't address community needs, and then risk goes unchecked, and then HIV infections go on the rise. This was an example seen in Kalkaska, a rural town in Michigan, saw new HIV infection rates exponentially higher than even urban communities such as New York and Detroit. We really leaned into addressing knowledge gaps in identification and preventative care. Here it was, we saw evidence pointing to the need to connect and address bias and assumption in that, for instance, there are no good ways to ask about sexual health history, or the patient will just tell me if they're at risk. Or the flip side of that of, I don't know what my risks are, so I don't want to talk about it. Or maybe I don't know what questions to ask as it relates to HIV. So here again, closing those gaps. And the push and pull, we've talked about that. Studies show upwards of 40% of the LGBTQ plus community find that they are educating their providers about LGBTQ health related needs. HIV is one example of that. So here again, we're trying to address that imbalance in power of the patients having to educate their providers, and that they can come to the office visit, for instance, with a QR code in hand and say, okay, so you don't understand what I need, go do your homework and let's talk. Also want to highlight that peer reviewers were leveraged throughout the creation of the PrEP toolkit and leaned into heavily. For instance, we have a number of physicians, one such triple boarded physician who works in infectious disease and addiction medicine, and really deep delve into what is it providers need to make this change, to move from, but we've always done it this way, or, well, that doesn't apply to me. Well, maybe it does. We also leaned into our pharmacy friends to talk about what tools we need as well as others. Also want to highlight one area that we really sought to address is that primary care can and should be testing for HIV as well as prescribing PrEP to prevent new HIV infections. These folks don't have an infectious disease and therefore don't need to be referred to an infectious disease specialist, and really trying to improve access. So that's another one of the goals we had. With that, let's take a tour, shall we? So here we are on the landing page of the PrEP and HIV toolkit. I do want to highlight that there is a QR code that we share at the end of the presentation, so you'll have access to the link in that way, and I'm sure that Cameron and Riley will drop it in the chat a few times as well. So here again, we talked about a tool built for your needs. Here, we truly represent the two-door approach visually and physically in a digital space, as it were. So the community doors, if we take a look in there, to what made the tiles or entry points into the toolkit for the community side really leaned into evidence again. So our community members, research shows that they don't understand what PrEP is. They also don't necessarily understand what their HIV risks are, and when to maybe potentially hit the yield sign as far as when PrEP might not be right for them. So let's take a little tour of a couple of these. And I don't want to steal all of the clicks, so I do want to encourage you all to go delve in and take a look around as well. So again, the design of this toolkit, we tried to leverage multiple different colors, texts, and links to help make it much more actionable and interactive for the community member, as opposed to just information overload. We wanted to keep things bite-sized and more engaging. You'll find throughout the toolkit a variety of links that are updated on the regular basis, as well as content. Should we learn new research, we toss that in as well. So linking to sources, trying to demonstrate that we're not just making this up, right? There really is evidence out there and supporting what you know. And speaking of meeting folks where they are, as far as the design and delivery of content, you'll note a difference between the medication overview on the community side versus the healthcare team side. It's different because their needs as far as information are different. Also highlighting how PrEP works. We wanted to make sure that folks understood the way the medication works so that they are more likely to be adherent to the medication and thus less likely to contract HIV. And certainly, again, throughout, you'll find all kinds of links leading to more from the CDC, etc. So let's take another look around. One other thing that we really saw, as I mentioned, was people not understanding their risk or making assumptions about what their risks were. So these steps to understanding risk and thus reducing risk, we really tried to break down and highlight here. Do any of these things apply to you? And each of these bullet points, again, is linked back to evidence-supported risks and patterns that we see in folks who contract HIV, who is getting new infections, etc. Another key item that we found as it relates to research and understanding the need was shutting down HIV and PrEP stigma. This we hear and we see in the literature as far as research as being one of the key elements that prevents folks from getting the care they need. Stigma kills people every day. And how do we disrupt that? Well, part of that is talking about the biases that are baked into HIV, its history, and the stigma associated with HIV's history. So, for instance, it being linked to the incorrectly labeled as just impacting gay men, for instance. We debunk this information and also disrupt and talk about what the barriers are so that then we can address them. So also want to highlight that HIV.gov does have a stigma fact sheet that you can link right out to. And as we are just kicking off Pride Month for June, something else to look forward to beyond June is the Zero HIV Stigma Day, which takes place on July 21st. So please delve in and learn more about that as you are exploring the PrEP Toolkit. So again, another one of the barriers to the community taking PrEP and filling that prescription when they do get it in hand is assumptions related to the cost of PrEP. How am I going to pay for it, right? So we delve into and provide tools to address those needs as well. So who gets coverage, who doesn't? How does this influence my out-of-pocket care? Interestingly, the federal government and the Affordable Care Act specifically have expanded coverage as it relates to PrEP and HIV prevention and associated care. So the medication, the clinic visit, and the lab tests to start on PrEP is all covered. And also in reflecting on who else might need PrEP, how does this influence? We understands that Medicare needs might be different. And so we certainly wanted to highlight that. And how to find out if PrEP is covered when we think about your health plan. Here, we've got a link out to a tip sheet to help you verify your coverage, as well as a link to learn more from hiv.gov to delve in more deeply, and encouragement for where to start. Sometimes that's just the igniter of where to start to solve the problem is that push that you need. And it might be just something as simple as flipping over that insurance card and calling. Also wanted to highlight and recognize that the LGBTQ plus community specifically is at higher risk for being or underinsured. So what does that mean as it relates to gaining access to PrEP? Well, here we've got some links out to support folks who may not have insurance and what they can do to get access to care in that way. One more area I want to go to before we shift a little bit more to pushing and pulling of information is access for clean syringes. This was something we wanted to make sure to include as when you can take on the model of harm reduction, we can reduce the risk or HIV associated exposures. So we wanted to make sure to highlight some for our home space of Michigan, downloadable syringe services directory and syringe service program finder. So where you can find those. We also, in recognition of not everybody lives in Michigan, we've got a North America syringe exchange network here, and which includes syringe zip code locator, which again is updated regularly to make sure that we are getting the information in hand that is current and reliable. Also, in working with our pharmacists, we learned that in the United States, pharmacists can sell syringes without prescription or specific reason. There's no federal rule that says you have to have a prescription for a syringe to get a syringe at an area pharmacy. So one of those lessons learned along the way. And again, additional tools from the CDC and other syringe service programs. Now let's delve into that push and pull, as I mentioned. So here is one of the examples of the push and pull moments that we have in the toolkit. So this is a QR code that will lead to the provider side of the PrEP Toolkit, which we'll take a tour of in just a minute. But with this, wanting to have something in hand and also some talking points to get ready for that visit, to start the conversation with a prescriber or provider as it relates to PrEP. So how do you even start and connect? Well, here are some pointers from one of our reviewers, Dr. Trowbridge, who even frames it as some actionable quotes, really trying to take the pressure off of how do you even start that potentially uncomfortable conversation and address that imbalance of power as it relates to the provider and the patient. Really, again, honing in on, you can do this, here's how. We also got some pointers from Dr. John, also known as That Gay Doctor, on Instagram and TikTok. If these video clips give insight and understanding of what tests are needed and what folks are at risk for, as well as how to start some of these crucial conversations to direct the care that you need. And yet another pointer to that QR code, and also want to acknowledge that we were transparent in building this with the community members can go to the provider side and vice versa. So let's take a look at that healthcare team or provider toolkit as well. So I slipped into the provider, but I do want to highlight that this is for the entire healthcare team, not just the provider. And again, as we saw on the community side, the tiles and topics that we included for this space were research-based. So for instance, understanding HIV risk assessment, as mentioned before, providers weren't understanding who was at risk and making assumptions. For instance, the outbreak seen in Kalkaska, rural Michigan. So with this, Ella leaned into research from the CDC of identifying who's at risk and built out this algorithm, something that's printable that you can commit to memory and or have as a pocket guide in the moment to help guide who we should be prescribing PrEP to, and taking a bit of a deeper delve and really seeking to eliminate those biases and assumptions that might be made along the way. Also highlighting who is eligible for PrEP. This was seen to a barrier of prescriptions getting written out for folks, and really trying to get who it's appropriate for. And this is another example of a link to the other side of the toolkit as it relates to getting financial resources to help address cost barriers. That was that we saw a few minutes ago on the community side. So here again, it's a push and a pull and an understanding of who is eligible and when prescribing PrEP is appropriate. One other, well, two other key elements as it relates to prescribing PrEP was providers didn't understand how to collect a sexual health history and how to provide PrEP. These two tiles were incredibly instrumental and key elements to include, and some of the areas that we see clicked most often. So what are the ingredients, as it were, to prescribing PrEP? What do you need as far as lab orders? And how do you understand who is clinically eligible? So this is an outline, step by step, who, when, where, and how. Also, a deeper dive for those folks who want to know more and go beyond the surface level overview. Gathering sexual health histories. I don't remember the statistic off the top of my head at this moment, but there is a huge disparity and in the number of sexual health histories that are actually collected in full. Oftentimes they are left blank or skipped entirely during healthcare visits, and this leads to, as you can imagine, gaps in care and addressing and reducing potential new HIV risks and opportunities to reduce risk. So here again, we provide key ingredients as far as how to step by step ask the questions that we need to understand so we can drive the way that we make decisions. Considering the 6 Ps model, this again is a evidence-based tool from the American Family Physician. And Dr. Trowbridge again left us with some thought starters to help drive that conversation and get folks engaged in completing questions and addressing but I feel uncomfortable asking. Well, here leaning into Dr. John. I'm worried my patient will get offended. Well, it's all about phrasing questions to be patient-centered in their approach. And we've got videos to demonstrate just that. And here again, resources, documentation tools, a quick link to the community member side, and then that push, right? So the community member the provider can pull this toolkit up on their phone or put it on discharge paperwork and include it as a QR code that then prints, and folks can take with them to when they are in a space and have decompressed a bit after a very busy and potentially worrisome visit with their primary care and beyond. They can look at it and learn from it in a space to which they feel most safe and thus most able to learn. So that's a bit about the toolkit, a tour in and of itself. So future projects, where are we going next? Well, leveraging evidence to build best practice alerts that acts to reduce risk is going to be one of the next things we do. So this, a best practice alert, for those that might not be familiar, is a alert that pops up as in front of you when you are taking a look at the electronic health record, for instance, a patient's chart, and an alert pops up that they are due for hepatitis vaccine, or they are due for a mammography. Well, what we are hoping to do next is build using a logic model similar to what I showed you a little bit ago, and grounded in evidence, of course, to create the logic model that the computer programmers need to build best practice alerts to assess HIV risk within the electronic health record. And we want to make it free and accessible for anyone that's running electronic health record in order to address that disparity in help close those biases and promote risk assessment. Also wanting to take a look at an assessment of care team experiences. How have they used the toolkit? Where have they clicked into it? What have feedback they may have gotten from patients? And next steps, future toolkits. So that we are planning on continuing to lean into that two-door approach. We are seeing a lot of positive engagement in that two-door approach and having folks leaning into that. So next up, we are hoping to create a sexual health toolkit, specifically addressing gaps and knowledge and bias and stigma for the LGBTQ plus community related to sexual health. Excuse me. And then also wanting to create one for the intersex community. What are their care needs? And there are lots of stigma, lots of lack of understanding. And we really believe that we can close some of those with a toolkit leveraging these same things. And then as far as successes, what have we seen? Well, the HIV toolkit just in the past 2 weeks has surpassed 700 clicks since its launch on September 28th. So that's super cool. In looking at analytics, we have representation from all 50 states in that experience. We also are seeing engagement from across the globe, from Canada, Great Britain. We've also seen a number of countries from Africa accessing the PrEP Toolkit. So here again, we're thinking about who needs these tools and how we can break down those barriers, and access on the web certainly is beginning to do that. With that, I will close in my gabbing along at our Lunch and Learn today and open it up to questions. I'm just going to click one further here. Here is a QR code that you can scan to access the toolkit from your phone. And we'll make sure that the toolkit's link gets dropped in the chat as well. And then if you're wanting to connect, have questions, this QR code will land you to me. And with that, I will open it up for questions. And again, thank you all for your time today.
We do have one question in the chat. What are the 2 drugs used?
Oh, there's 3 drugs used. Yeah, great question. So let me pull that up for you. So there is Descovy and Truvada are the oral medications, and that's the brand name. There is off-brand as well, or excuse me, a generic available as well. And there is an injectable form of PrEP. So let's take a look at that quick. There we go. So Descovy, well, let me back up. All of the forms of PrEP are made up of 2 medications as far as oral medications go. Descovy, as I mentioned, and then Truvada. Truvada does have the generic available. And then the injectable form of PrEP is highlighted here for you. And that one is long-acting medication that instead of having to take every day lasts for over the course of 2 months. any other questions or anything else I can offer up?
I have a question. So are there any differences between prescribing people assigned female at birth versus assigned male at birth?
As far as
Prescribe.
clinical?
Yeah.
Sure. So oops, let me get this one back up just in case. Sure. So folks with vaginas have to take PrEP longer before they reach a therapeutic level, which means before it's going to be fully effective at preventing HIV. So it's also more important for folks with vaginas to be taking it on a much more regular basis to keep that level at a protective state. Something about vaginas and the acidic nature of them. That I don't think we fully understand yet. I know research is ongoing related to PrEP and folks that have vaginas and ensuring efficacy and dosing rates appropriately.
Yeah, thank you for that, Jay. I'm not seeing any more messages in the chat. So if we don't have any further questions, Jay, do you have anything else to add?
Biggest thing, click around in the toolkit. You're certainly not going to break anything. We are open to questions at any time. Feel free to, there are links in our website to email us with questions and suggestions. And hopefully you find this toolkit to be of use. And we look forward to hearing from you.
Thank you. Cameron, would you like to close us out?
Yes. Okay. Well, thank you so much, Jay, for sharing your time about this service. We appreciate how your work is impacting the LGBTQ plus community. Again, I would like to remind everyone about our Give Butter campaign. Please feel no obligation to give, but if you would like to, we thank you so much for your contribution. You will be receiving a follow-up email soon after the webinar about this information and links to this information. If you're receiving CEU credits for this webinar, this information will be included in that email. I want to remind everyone again about the session. It was recorded and it will be uploaded to our website in the next week. We do have 2 webinars this month, actually. The next one will be on intersex identities on June 18th. If you're interested, please register on websites and be, sorry. If you're interested, please register on the website and feel free to spread the word. Thank you so much for everyone for attending. Bye, have a good one.
Take care, everybody. Thanks for your time today.
Oh, you guys can't hear me?